This is the most common concern that I hear regarding the flu vaccine. The injectable form of the vaccine does not contain any live virus. It just contains parts of viruses for your immune system to respond to. When we test these viruses, or when we test these vaccines, they give a group of people salt water and they give a group of people an injection of the vaccine, and they look at the results, and the people who get the vaccine don't really get any sicker than the people who got the salt water. I think what's going on is that the flu vaccine is administered around the same time as respiratory season is starting, so people are already starting to get sick. And I think that maybe they get a cold and they blame it on the vaccine. That's not to say that the vaccine doesn't have any side effects at all. It can cause a little bit of site soreness and maybe a low-grade fever and a little bit of kind of feeling crummy for a day or so, but that is a very far cry from the wild type influenza vaccine or influenza virus infection, which causes really bad fevers, body aches, cough, congestion, headaches for about a week or so, and it's generally pretty severe. One of the insidious things about the flu virus is that it's not very well built. It's what we call an RNA virus, and it doesn't make very good copies of itself, and that means it's always changing. The vaccine is primarily against a molecule called hemagglutinin. This is the H in H1N1 or H1N5. And hemagglutinin changes pretty frequently. And so what people who make the flu vaccine have to do is they have to guess which strains of hemagglutinin they think are going to sweep across the United States every year, and they put those in the vaccine. Flu vaccine effectiveness varies from year to year, depending on how well those experts guess which strains are going to sweep across the United States. But overall effectiveness hovers right around 70%. There was a newer version of the flu vaccine called the intranasal. It was a nasal spray, and that one turned out to not work as well as the injectable form. So most places recommend the injectable form as opposed to the intranasal form. Just like every other vaccine, the flu vaccine is extensively tested before they market it because we give these medicines to everybody, so manufacturers have to go through an extensive testing process. There are some side effects with the vaccine. Most of the time it's just site soreness, can cause headache, a little bit of muscle soreness, maybe a low-grade fever for a day or so after you get the injection. The risk of severe side effects is less than 1 in a million. And flu is much more common than that. I will say the risk of complications from the flu is much, much, much higher than the risk of a side effect from the vaccine. So the best reason to get vaccinated against the flu is to protect other people who can't get vaccinated or who will get really, really sick if they get the flu. So young babies and older folks generally have less protection and tend to get pretty sick with the flus. So if you're going to be around those people, or even if you're not, you should think about getting the flu vaccine.